Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you to my interview with two of the authors of an important and interesting article from the February 2026 edition of the Journal of Rheumatology. Today, I'll be speaking with Ms. Natalie Davis and Dr. Jeffrey Sparks from the Division of Rheumatology and Inflammation and Immunity, Brigham and Women's Hospital, Harvard Medical School, Boston, Massachusetts, USA. And this is on behalf of all the authors of our featured article titled, Investigating Factors Associated with Respiratory Syncytial Virus Vaccination and Breakthrough Infection Among Patients with Systemic Autoimmune Rheumatic Diseases. And I want to thank both of you for taking the time to speak to me and to our listeners on behalf of all the authors of your paper and to discuss findings of your important paper on vaccination in patients with systemic autoimmune rheumatic diseases. So with that, we'll start. So we all know that vaccines are important to protect the community from infection, but why did you choose RSV vaccination rather than any other of the recommended vaccinations?
I can take that one, Earl. Again,
Sure.
thanks for having us. We really appreciate putting a spotlight on this. As you know, infections are at the front of our mind when we're treating our patients because of their altered immunity and the medications that we use. Our group in particular has been very interested in viral infections, mostly focused on COVID, but obviously there's a lot more viruses out there. And our group is also interested in the lung as an initiating site and as an important clinical event. So everything was all kind of lining up there. And I did think that RSV has been in the news a lot, mostly related to kids, and it's not really been studied too much, particularly in adults and immune suppressed individuals. And also there's this new vaccine. So I think it really hit all those themes related to the lungs, related to a specific pathogen. And now we do have an intervention with the RSV vaccine to hopefully mitigate that risk. So there really hadn't been studies that were focused on RSV vaccination within systemic autoimmune rheumatic diseases. So that was the rationale about why we wanted to start on this study.
Thank you. Yeah, I didn't mean it defensively. Being over 65, I understand the importance of vaccination for RSV, although I didn't get it. Whatever. Anyway, could you please, and we'll get into the study, outline the study population, the time period study, and your outcome measures?
Sure, I can take this one. So our study population was patients with systemic autoimmune rheumatic diseases in the Mass General Brigham health record. We identified all patients with SARDs who were 60 years or older and thus making them eligible to receive the RSV vaccine. Our study time period was between May of 2023, which was when the first RSV vaccine was approved, and February of 2025, which is when we started the analysis. Our primary outcome was whether patients had received the RSV vaccine in the electronic health record, and we also measured a secondary outcome, which was patients who had a positive RSV test after vaccination.
Okay, thank you. Well, yeah, I think we answered why your study was then. So what did you find?
I could do that one. So first off, it was a pretty large sample size, 10,587
Wow.
patients. And again, these are patients who were eligible for the vaccine at the time. So both had a systemic autoimmune rheumatic disease and were 60 and older. As a slight caveat, since we published our study, they did relax that eligibility criteria. So now 50 years and above is actually
Oh,
eligible. But at the time we did our study, it was 60 and above.
okay.
And actually, one of the major aims of this was just to figure out who got vaccinated. And we were debating before we got the results. Certainly wasn't going to be 100%. Hopefully, it wasn't going to be 0%. Was it going to be 50? Was it going to be 30? Was it going to be 5? And it ended up, we found that 10.2% were documented to have received the RSV vaccination. The caveat there being that of course, it had to be documented in our records. There is a Massachusetts vaccine registry that does allow outside vaccines to get into our system, but certainly there could have been some other people that got the vaccine that were outside of our system. However, I'm doubtful that that's going to double or triple the amount. So the 10.2% is probably the, lower limit here, but overall, probably only 1 out of 10 got vaccinated, meaning a 9 out of 10 did not, or maybe
Right.
it's 8 out of 10, but surely, many people did not get vaccinated. And we expected, obviously, to not have complete uptake. The second part of the study was really looking at factors associated with uptake. I think Natalie would take us in more detail there. Interestingly, the major factors were related to general population factors, things like race, socioeconomic status, age, and I think Natalie will tell us more about some of the other factors. And then there were only a few breakthrough infections, meaning documented RSV vaccine infections after the vaccinations, and only 2 of those were severe.
Uh,
Natalie?
Just to highlight a few of the factors that were associated, a flu vaccine receipt within the last year was the most strongly associated factor, and then as well as a COVID vaccine receipt within the last year. As well, patients with interstitial lung disease were also more likely to receive the RSV vaccine, and glucocorticoid users were less likely to have received the vaccine.
That's an interesting finding, the last one. Very interesting.
Yeah, I'll
Um,
mention that some of there's been so much written about B cell depletion and COVID outcomes, but and
right.
probably many other infections. So we actually expected the people on rituximab to be much more likely to get the vaccine, but in our study, but despite there being many patients on rituximab, those patients were not any more likely to get the vaccine compared to others, which was a bit surprising, I thought. And also thinking about some of the other medications that are more heavy-duty immunosuppressing, none of those were associated with getting the RSV vaccine. Really, the only medication that was associated was glucocorticoids. Interestingly, those patients were less likely to get it. And obviously, a lot of factors probably go into why those people were stuck on steroids, and maybe a lot of those patients also have lots of barriers to getting the vaccine too.
So I know I didn't ask you this in advance, but was the vaccine covered for most people, or do they have, if they don't have private insurance, is there public coverage for vaccine in Mass, despite what RFK Jr. wants? I had to throw that in. I'm sorry.
Oh, you went there, Earl. Yeah, I can take that one too. In Massachusetts, at least at the moment, we have Mass Health, and there's actually very, very few people uninsured here.
Oh,
So this would be covered, probably for 98% of the
okay.
population within the state. I'll say that Mass General Brigham does cover some neighboring states like Rhode Island, New Hampshire,
Mhm.
Maine. So there's a bit more less insured people in those states. But in theory, at least, insurance was not a huge barrier to getting the vaccine. But certainly
Right.
availability is not universal, and there are a lot of hoops to jump through in order to get the vaccine that we might touch on.
Yeah. Okay. But the question, of course, is as we're talking about who got vaccinated, is there a documentation on each visit about vaccinations? Like you in your EMR, is there like a question that you document, or is there a prompt to ask?
Yeah, that's a good question. It's certainly not systematic. I think people who are there's some primary care providers who do a great job about
Mhm.
figuring that out and have intake. I think our patient portal allows you to say whether you're vaccinated. It also says why you're eligible and prompts you to get the vaccine. But certainly not everyone uses the patient portal. Not everyone has a PCP in our system. And again, we do have this state registry that does shunt them from um, places like CVS, Walgreens, et cetera, where people
Right.
often get vaccinations. But certainly, the accuracy is not 100% for sure. But if it's documented, they for sure got it. And we do have
Sure.
dates as well as administration.
Yeah. So I guess if anything, you're underestimating.
Yeah, this would kind of be the lower estimate.
Right. Okay. Um, Along those same lines that you're talking about the infection rate, which is really quite remarkably low and fantastically only 2 hospitalizations and no deaths. So that is amazing. Um, Again, same similar questions. What happens if they went to another facility, not affiliated with your system? How would you is there a way centrally to document that, whether they're hospitalized or not?
Well, we do have a lot of hospitals in our system, but certainly some people might get hospitalized outside of our system. We would not be able to capture that, but I think most people that get their vaccines within our system would also be able to be hospitalized here as well. Um, we've done very similar studies with COVID, and we're certainly catching all the COVID hospitalizations, or nearly all, I should say. So we are, I think, pretty confident that the number of hospitalizations was very few in these patients.
Very good. I guess my question, it's a remarkably low hospitalization rate. Do you have any guess or ideas of the other, I guess it was over 8,500 patients who didn't get vaccinated? Is there any feel, or did you look at how many hospitalizations or deaths from RSV in the non-vaccinated, just to give a feel? I know it wasn't the point of your study for efficacy, but I'm just curious if you had that data.
That is a good idea. And in fact, the way we approached that is that we actually had a separate paper. It's in a different journal. Sorry, Earl.
Oh, no.
Basically, our approach was that you had this kind of natural experiment, if you will. Before 2023, there was no vaccine.
Sure.
After 2023, there was a vaccine. So our previous study basically looked at outcomes among RSV for rheumatic patients in the pre-vaccine era. And granted, the time span is a bit different, but there were many hospitalizations.
Sure.
That would have been a good approach as well to look within this subsegment who were eligible. I believe that wasn't part of that paper, but we kind of staged it related to hospitalization rate before the vaccine era, and then this one obviously is very early in the vaccine era, but it seems very encouraging that this is highly efficacious. And I'll remind you that obviously there's lots of infections that don't get tested in the outpatient setting, but if patients are admitted to the hospital sick with pneumonia, intubated, those are the patients that we typically do test broadly. So I think we're a bit more confident that the severe infections were very, very few, and there were no deaths and only 2 hospitalizations among this large sample, which I think is very reassuring.
Yeah, I agree. I mean, I'm sure some minor infections are missed all the time, but it's like every other vaccine we have, and especially true for the flu. They say you may still get the flu, but unlikely to be hospitalized, which is what we care about. Significant infections. Absolutely. So this is vaccinations are so important and so low rate of vaccine, and it's dropping not only in your country, but I see it in Canada. I'm sure it's worldwide. Canada just lost our measles. We now have not measles free, okay, because of the anti-vaxxers. So any
I guess we imported
thoughts?
that to you, Earl. I'm sorry.
Well, I don't know. Yeah, well, that was actually, I think the one we got was native born. Somebody went to Europe somewhere where they have these people who don't get vaccinated. I know this is the $100,000 question, I guess. How do we increase vaccination rates in our patients? And we'll focus on viral for the moment because, COVID's out there, flu's out there. I mean, we have 3 significant respiratory infections that are seasonal, and we have immunosuppressed patients. Any thoughts? I'm sure you've thought about it.
Yeah, we've definitely thought about it, and I can lead us off and then maybe
Sure.
ask Dr. Sparks for ideas as well. But I think providers can be big motivators for patients to be vaccinated, and particularly rheumatologists could encourage their patients when they see them in clinic, and also being aware of who is eligible to receive, for example, the RSV vaccine, according to new guidelines. This was also a newer vaccine, so continued safety and tolerability studies will hopefully continue to give supportive data and improve vaccine hesitancy, like you had talked about. And then also, after your provider mentions a vaccine, it would be helpful for clinics and rheumatology clinics to have the RSV vaccine on hand so that when interested patients are there for a visit, if they're eligible, they could receive it right there rather than having to go seek it out elsewhere.
Waiting for that. I mean, it's been talked about so much. I mean, you could have in the respiratory both COVID and flu plus RSV in the eligible patients. It's just a matter of funding somebody to sit in your clinic. I think that's the way to go. I agree if we could do it. So I want to thank you. Would you like to add anything? You know, sometimes I try to ask the important questions, but even I'm not infallible. So anything to add?
Well, our team has a research program related to infections, particularly respiratory infections, both viral, bacterial, fungal. Um, Obviously the pathogens that we have vaccines for are really important, and obviously I think we need more vaccines. We need to figure out the exact patient population that should receive it. Quantify harms, quantify benefits. And, this is a new vaccine, so I do think there's a fair amount of work that needs to be done. I don't think, it probably makes sense that day one we wouldn't expect everyone to get it. But hopefully this is the first step into, quantifying benefits. I think we saw probably a lot of benefit here. It also opened up some areas as far as subgroups of patients that might be beneficial. For example, the ILD patients seem to be receiving it. The
Right.
B-cell depleted patients aren't receiving it as much as we would have thought. And the glucocorticoid patients treated patients are less likely to receive it. So I think this really opens a lot of doors. And again, we're really thankful to our funders to help to allow us to keep doing these studies.
That's fantastic. You know, as we're talking, I remember there was a paper we published maybe a couple of years ago looking at how to increase pneumococcal vaccination. And they had a prompt on their AMR for every one of their patients. And until it said, yes, I've been vaccinated. And they vaccinated the patients in clinic. And their control group, these were the full-time staff versus the part-time staff who didn't get the prompt. And vaccination rate was 80% versus 20%.
Yeah.
It's exactly what you're saying. You get the prompt and you have the vaccine, and you have a captive audience.
All right. I think we got a roadmap here. We really appreciate the journal too for spotlighting this and publishing the paper.
Fantastic. And I want to thank you both for taking the time to findings. And I think vaccinations is so important. And again, I want to thank you for bringing to the attention of the community how we can increase vaccination. And to our viewers and listeners, please read the full article titled Investigating Factors Associated with Respiratory Syncytial Virus Vaccination and Breakthrough Infections Among Patients with Systemic Autoimmune Diseases, which is available at our website at jroom.org and in the February 2026 print edition of the journal. And I want to thank you for joining us and hope you again join next week when I speak to one of the authors of another paper of particular interest. And the full interview is available at our website. And thank you. And love to hear your comments, and available at x@jroom or by email, the manuscripts at jroom.com. Thank you.